Hey, good morning, good afternoon, good day to everybody. This is Amanda Pierce-Kelly. I'm the Executive Director of the Association of Clinicians for the Underserved, and I'm so excited for the conversation today and to be able to connect you guys with a really wonderful new partner of ours that we've been excited to be working with for a few months now, but this is our first opportunity to get a little bit more in-depth about some of the supports and services that they can provide and really to hear from you all about what's needed and understand, what we can do together to overcome some of the challenges in creating a really strong, vibrant organization that supports a culture of resilience, but I think more than anything makes it one of the best places to work, employer of choice, which we all are so familiar with in terms of our endeavors always. You can see our title today, Creating a Resilient Culture for Community Health Centers and Why a Band-Aid Approach Won't Work. You will hear from our fantastic speakers about that and that this is really a long-term commitment, which, when we have so many competing demands at one time, sometimes that can feel daunting, but it is worth the investment. It is worth the energy and the long-term vision, honestly, around what can be to continue to transform your organizations in a way where they will continue to thrive and serve as the model, honestly, as they often have across the healthcare system. I'll start really quick. We're going to go to our next slide here, Paul, if you want to. Just as a reminder about who we are at ACU, but also a little bit more about Smart Conversations. So hopefully you all know ACU. We are so proud to be a transdisciplinary membership organization, and we work very hard at uniting a lot of different stakeholders across our network and our membership. We are very focused on our work in the workforce space, specifically around establishing, supporting, creating a robust and diverse workforce. And that is really geared at true transformation across communities and to achieve health equity. That is the story of ACU. And frankly, I think that's the story of health centers and really anyone who's doing work in underserved communities. Equity has always been at the core of that, but it's difficult to achieve equity if you don't have that diverse and thriving workforce, which can then support the transformation at the community level. Our partnership with Smart Conversations is really to help you all, health centers and others working in underserved communities, to improve organizational effectiveness and boost financial solvency and inspire workforce excellence. So these are areas of work that you all are very familiar with. And our STAR Center, as you know, does a lot of this work. But what we're really thrilled about in the partnership with Smart Conversations is that it is not just aligned with the work of the STAR Center, it's additive. And so a lot of the supports and resources and services that Smart Conversations can bring to you is much more in depth. It is one-to-one, it is long-term and sort of in partnership and concert around that vision of sort of workforce excellence, financial solvency, and I think organizational effectiveness. And so you're going to hear from them directly to give you a bit more context. But I'm just thrilled because, ACU is always looking at how can we do more to support you all, to support our members. We're constantly looking at across the environment and across the network to say, what are the continuing needs? What are the emerging challenges to stay ahead of that? And I'm really pleased to say that I think Smart Conversations, as I mentioned, is just another tool in the toolbox to build on the incredible work that ACU has done, that so many of you have done. So just excited to continue to build on the partnership we've been working on for a series of months, but also for you guys to get to know these fantastic partners. The last thing I'll say is that they speak our language. They have really rich experience with health centers directly. Dr. Williams, who you'll hear from, has spent time working with health centers firsthand, as have Paul and Michelle, and that matters in terms of the partners we choose to work with. It makes a big difference when I speak with someone who not just understands and appreciates the mission, but is very much familiar personally with what it actually looks like and how it operates on the ground. And so that's one of the things that excited me most when we first started talking with them many months ago at this point about engaging in a partnership. And I think their openness to continually learning from you all about what's actually needed and refining the approach, the tools, the strategies, and the tactics that we can deploy to help support you. So with that, I will turn it over to our fantastic partners, Dr. Williams, Michelle, and Paul, to take us through this presentation. And I think what we're going to end up doing is probably leaving some time at the end for chat. And I know there's going to be opportunities throughout the presentation for folks to chime in and offer comments and feedback. We are recording this so that there will be access later at the end, and certainly to share with colleagues. But don't be shy. Use that chat function, share messages, and know that you can always be in touch with us directly if you need anything at all. So Paul, I'll turn it over to you.
Wow, thank you, Amanda. That's just wonderful, and really appreciate the introduction. Let me start by saying that we're honored to be involved in this partnership. We're honored by the presence of all of you that were able to join us today. Very exciting, and a couple of things to share before I actually dive into the actual theme of the presentation today. One of the hallmarks of Smart Conversations trainings is its intention to be engaging, to be interactive, and we're going to be very much encouraging you to participate through the chat system. And we'll be monitoring that and looking for opportunities to take things a little bit deeper. The other thing that we want to share as part of the way we go about what we do. There are three of us as part of the presentation team in terms of the theme of resilience, and we give each other permission, if you will, to add along the way. If one of us is covering a topic and something occurs to one of our colleagues, they have permission to jump in and to add and deepen that material. So just know that as we go forward, that's an important part and okay from our perspective. The other thing, I just want to echo what Amanda said about respecting the wonderful work that's already being done by ACU. We get that, and we see ourselves as complementing it and building on and adding to where there is value to be created as a result of that. And so that's also part. And so we're very excited to be at this beginning point in this relationship. So let me take it. I'm going to introduce our co-presenters in a second here, but one of the things we do is start our presentations with a quote similar to what's up on the screen now. And the idea is to kind of get the thinking going. And we're going to connect the dots between Smart Conversations and the theme of resilience that's front and center today. But, you know, change and adversity and resilience, there's connectivity there, and there's a way to get from point A to point B. And we're going to do our best to help kind of make that connection for you as we go. But give this a little bit of thought as we continue to move forward. So again, I'm Paul Wiseman, president of Smart Conversations. With me today is Dr. Williams, president of HW Healthcare Solutions, and Michelle Simos-Wiseman, Chief Learning Officer with Smart Conversations. So welcome to each of them, and we'll all be giving you a little bit of an opportunity to engage with us. So here's a little outline of our learning objectives. And so I'm going to let you read those on your own, but just point out that we're going to be talking about smart cultures and a strategic approach, and establishing a framework for resilient relationships, filling in a little bit on what do we mean by psychological safety and how that's so important. And then we'll do a little bit of begin with the end in mind. That's drawing from a thought leader by the name of Stephen Covey, 7 Habits of Highly Effective People, which is one of the shoulders that our work rests on. And so we like to give acknowledgement to that. So I'm going to ask Herman, Dr. Williams, to pick it up from here, and we'll continue on. And I'll come back a little later.
Thank you, Paul. Thank you, Amanda. And welcome everyone. It's an honor for us to be here with you today. I'm going to talk about smart cultures and a couple of different smart things, and I'm going to let your mind wander. That smart is a mnemonic. But for the time being, let's accept it for what it is, just smart, intelligent, great. Responsive cultures help community centers. First of all, let me acknowledge the hard work that you're doing. I've never gone to any health center where everybody wasn't wearing 1,000 different hats and where you've had difficult populations to manage. You're working with healthcare disparities, you're trying to plug holes. So you're doing some incredibly engaging, incredibly difficult work. And so I just want to acknowledge that right away. But if you have a smart culture in your healthcare center, it's obviously better and helps you respond to certain things like public health crises. Everybody's heard us all reflect on COVID, but I think I'd like to look at it from a different perspective. That is that this is a 100-year pandemic, which means that this only happens every 100 years. So we've had the unfortunate time to be here, but the beautiful time of being able to respond to one of the most complex pandemics this country and the world has seen and come out on the other side in a great place. And so reflect on the culture that got you through this incredible healthcare crisis. Of course, if you have a smart culture, it helps you challenge the barriers of workforce retention. So if you have a great culture, people want to stay. And that's why it's important to have a smart culture. It obviously will help you create financial stability. And if we do what we're doing and we provide consistent high quality care, then we get that trust with the communities that we serve. And we were talking prior to starting this session with Amanda about how nice it is that a lot of people appreciate the hard work that we're doing, and the communities appreciate and trust us for the work that we're doing because they know how committed we are to our mission. You certainly have to be agile, you have to adapt, and you have to have innovation. And sometimes being a small health center helps you be nimble and provide innovation and continuously improve because you're small and nimble. So we want to honor those sorts of things and how that really helps having a smart culture. Let's go to the next slide, Paul, and this is your opportunity to get involved. What we'd like you to do is go to the chat and let's have a conversation. Just whatever pops in your head, what's been successful for your health center and what needs to change. And while you're thinking about that, I do want to also reinforce what Amanda said about the Star Center and the resources that are available to you there. So if you have any questions about the Star Center and those resources or getting access, this would also be a good time to put in the chat, and we'll get back to you after the session. But so those are the two things, or three things. What's been successful, what needs to change, and if you have any questions about the Star Center. And while you all are thinking about that, let me share what thoughts have come up with other clients that we've talked with. Is the things that have really been successful is their health center coming together as one unit and being able to withstand the challenges that they faced. They felt a sense of unification over the last year. Anybody feeling a sense of unification, or anybody feeling, I know a lot of folks really came and came out on the other side of this pandemic as true leaders because they were able to rise to the occasion when we were challenged in such a way that COVID has not challenged us in a while.
Herman, let me just ask Rick a quick monitoring of the chat. What's coming up so far, Rick?
We've had two comments come in so far. One of them is what's been successful for me has been learning more about the Star Center and watching the webinars provided by ACU. And another one is have gotten turnover more in control. Still need to move from being so outcome focused and more people focused.
And those are great traits.
Dr. Williams, oh, sorry. I was just going to add something that I don't know if you guys have had much experience with, but just in observation of some of our folks is that through the pandemic, everything changed, right? Our entire world changed. And health centers, and I think all healthcare or most healthcare providers, but they were walking into the fire every day, not knowing what was going to happen, but very committed, obviously, to continuing to fulfill mission and the needs of their patients and their communities. But I think as we've seen sort of a change as we're moving forward in the pandemic and away from it, it's really shifted things operationally for a lot of health centers, even in terms of like workflow, and the role of technology and how do you manage the staffing challenges and all of those things. And so it's been really fascinating and inspiring to see the way that individual health centers have taken that on, but also that there is this continual need to change and evolve because the operational side has changed. It's sort of like telehealth was not as prominent as it is today. And so what does that look like in terms of creating that cohesive culture and staffing up adequately and providing kind of balance around all the needs of the patients, but also I think the staff. So that's just a flag too, or just sort of a thought to share with you guys. And I think there may be other comments that have come in. Rick can chime in if that's the case.
There
have been some other comments, yes. I can see here that people have indicated coming together, improving staff buy-in to the mission. The beauty about the work that you all do is it's very mission driven, so that you can always remind yourself, why am I coming to work today? Is to do the great work that we're doing. Someone else put here, our staff came together as a team during the height of COVID and was really great to see. And so this whole theme of collaboration, coming together to fight a common enemy, combat turnover, things of that nature.
And we've heard that. We've heard that from a lot of people, that everybody came together during the time when COVID was at its highest. And then the question I have is, what are you doing to keep that going? Because people do well in emergencies. They know how to come together. But now that we're, pretty much hopefully behind that, how do you sustain that? How do you stay? What was great about people coming together? What were the best practices, for example?
So it'd be nice if anyone can respond to what Michelle just asked of us, but let me continue reading here. Some people put improving staff buy-in to our mission was key. Respect of the role of community health workers through the challenging crisis. But can anyone name something specific? Any best practice that they took out of this?
I can share one that I know of. One thing that I think began in a slightly different way than maybe in the past during the pandemic is bringing interdisciplinary, but I think also sort of varying levels of leadership and non-leadership together to really coalesce and brainstorm around the best path forward and sort of the needs of the teams. And that's something that started somewhat by necessity during the pandemic, but I think a lot of organizations that I've talked to have continued that or some form of it, and have really recognized the value of just the different voices, or the non-traditional voices in really helping to determine the direction of the organization and taking on some of the challenges and the role that they can play.
Mm-hmm. Thank you for that, Amanda. All right, I don't want to spend too much time here because we've got a lot of things to cover, but let's just use this slide to reinforce what Amanda said from the beginning, that, this is a long-term process that has a long-term vision, and taking a Band-Aid approach to the challenges that health centers face is really not sustainable. Is that you've got to have a committed effort to giving you the necessary tools to be successful and to be resilient. And these are just some examples of organizations that we've worked with where you have a one-off training. You send everybody out for a day or two to talk about burnout, then you come back and find out the 2 days you've been out, now you're 2 days behind in your work. So you're even more burned out, and then there's nothing else done to address it, or leadership's not really bought in. There's no long-term commitment. And I appreciate Amanda stating this from the very beginning, that this is rooted in a long-term commitment and vision. But you need resources, you need employee buy-in, and you need to dedicate those resources to your employees. Now, I'm going to hand it over to Michelle Simos, who's going to dig a little bit deeper into this smart culture. And what does it mean to be a smart culture?
So
Michelle?
thank you so much, Dr. Williams. I did want to mention before I get started, I want to echo everything everyone said so far, that we're very grateful to be here, and we're very grateful for what you do. We know that you're the key to keeping underserved people going and healthy, and thank you for that. I also wanted to mention Kelly put in here a little comment about she has monthly stress relieving activities, including an hour of painting. That's particularly appealing to me because I'm an artist, and I get great relief and release from some painting. So I think the arts and the humanities are a good way to go. So the idea of this infographic is that the change, while long-term, there's a system. Community health centers are no different from any other business. There is a system in place. And if you change one thing in the system, everything else is going to change in the system. So when you look at to this roadmap to resilience, in our world, in organizational development, that's what we do. Change starts with the individual. It's about me, or it's about you. It's about looking at what triggers me, reflecting on that, being open to changing that behavior. So how do I see myself, and am I willing to, and can I make changes to bring my game up a level in terms of relationship building, in terms of collaboration and cooperation? Once the individual has had some training or some coaching or some kind of work involving, improvement, self-improvement, then we go to the team. And then if individuals have already realized some part of self-awareness, then now as a team, we can gather, we can get together, and we can work within team dynamics, which are very different, of course, than working alone. And within those teams, we also have the need to get along with others. And while that may seem very simplistic, it is very hard. We are brought into companies a lot of times because people just don't get along with each other. They don't respect each other. They don't trust each other. So we work at the team level, and then you can experience organizational change because everyone is speaking the same language, and everyone knows how to bring up the difficult topics, and they know and buy into the values of the organization, which hopefully overlap with the values of smart conversations. So this is just that systems view of what needs to happen when you want to change culture and become more resilient. So a strategic approach is needed for that system. Again, Dr. Williams mentioned before the Band-Aid approach, the one-off training. I've had clients called the flavor of the day. And I've gone into many places where I have the best intentions and people had the best intentions. And then there was one training, and they would tell us that they're only going to do this training and there won't be any changes from it. So people were not engaged in the training because they didn't trust the management. They didn't trust the leadership to actually do anything with what they were saying and the ideas they were coming up with. So the first step is engaging employees in the process. we often think about, as leaders, we often think we know the right answer, we know the best answer. It's really the employees who are on the ground who need to be able to participate in that. Identifying, addressing stress and burnout, critical. Making a long-term leadership commitment to the process. Also modeling open, transparent communication among leadership. Promoting a comprehensive program that has reinforcement, that has different parts to it so that all parts of the employee experience are positively affected, and the patient experience. Because whatever the employees do well or poorly is, of course, going to affect patient relationships and patient outcomes. And the last one is creating a psychologically safe work environment. And we'll talk more about that in a moment. So Paul mentioned earlier, Stephen Covey is one of the thought leaders we've drawn from for this work. And this relates to starting with the individual. Self-mastery and self-discipline are the foundation of good relationships. And that's what this is all about. This is about good relationships. And what you'll see as we go on is that we have 4 core conditions and 5 principles, and they are portable. This is a framework you can use to build your relationship with your partner or your spouse or your significant other. You can use it with your children. You can use it in your work within the community. It's very effective, and it's right there at your disposal when you want it. So where does psychological safety fit in? Well, the #1 predictor of high-performing teams is just that, and that's what our work with Smart Conversations does. It creates psychological safety so people can be together, talk together, take action together, get along, and be able to even bring up the difficult topics. So Paul, if you would go to the next slide, we'll go a little bit deeper into what that means. So Google embarked on a study a few years ago. It was called the Aristotle Project. And they wanted to figure out what are the components of the ideal team. And what they found is that, again, psychological safety was #1. It wasn't, do we have 2 developers on the team, a marketing person, a salesperson? No, it was, do people on the team feel safe? Do they feel others are going to engage in retribution, ridicule, make judgment, retaliate? If all of that was put aside and they felt safe and comfortable and they wouldn't be judged, and even their perspectives were not just welcomed, they're appreciated, that's when they're psychologically safe, and to be authentic, to be themselves. And where that happens in our work, Paul, back one, please.
Sorry?
That's all right. Where that happens in our work is engaged listening. And engaged listening is where we find empathy and understanding, among other things. But these are the 3 parts of a conversation: asking questions, listening, and speaking. And we learn when we ask questions and we listen, not so much when we speak. So thinking about that, about asking questions and listening, and that creates a learning climate in an organization. So I'd like to introduce you to the Smart Conversations framework. The SMART acronym stands for shared meaning. That means, are we talking about the same thing? For example, if I'm having a conversation with somebody about a CD and I'm talking about a compact disc, we're going to have a very different conversation if they think I'm talking about a certificate of deposit. So it's getting that clarity of what are we talking about. Authenticity. There are internal and external components here. Authenticity. Am I being real with myself? And am I being real with you? And can people tell if you're not being real? Absolutely. And how much trust does that build? Respect. Do I respect myself first? Can I respect others? And trust. Do I keep promises to myself, keep my word? And can I offer that to others? And if you picture this as a balloon, And you imagine blowing in more and more shared meaning, more and more authenticity, more and more respect, more and more trust. You can see we can have a much bigger conversation. But as soon as one of those conditions is removed, the entire conversation collapses. And that's partly where intention comes in. What's our intention in this conversation? Are we intending to be collaborative? Are we intending to be right, be in control of something? Or are we intending to build something together with others? Are we intending to be engaged in innovation and engage everybody in the conversation? So that's the really pivotal piece, is intention, and thinking about your intentions when you do go into a conversation. I'm complete, Paul.
Yeah, just trying to get it to cooperate with me. There you
Okay.
go.
All right. So these are the five principles of smart conversations. Again, portable, mobile, easy to apply. The first one is connect first, and that's about the small talk, which yields a big impact. Instead of going over to someone, barring an emergency, instead of going over to someone, I want you to do this or that, I need this or that. You know, how was your weekend? How are your kids? Whatever the city baseball team is talking about that, but making a connection with someone. Number two, it takes two. This is the personal responsibility principle. That means you're responsible for your half of every relationship. I'm responsible for my half of every relationship. And this is also where identifying our trigger style comes up, which is avoid or attack. Number three, so the first two parts, 1 and 2 and half of 3, are about me. So this is the self-awareness piece. And the second half of 3, 4, and 5 are about us. So listen up. This is, again, building empathy, really looking for understanding. We're not thinking about what we're going to say back to somebody and have that little, disc jockey rolling around in our head. It's about really listening, taking it in, and looking at it from the other person's perspective and from their experience. And then the pivot to it's about us is speaking up. And that's where we have the skills to bring up undiscussables, things that people think and feel but do not feel safe saying. And we have a lot of tools for that to make it a psychologically safe environment for you to do that. And numbers 4 and 5 put the we before the me. That involves another tool called the shared interest model. It's about coming to consensus and doing what's best for the group. And we can do more together. And that is about synergy, that the whole is much greater than the sum of the parts.
So if I may, Michelle, let me double check. Are you complete with what you wanted to do with this slide?
I am. And if you have
Okay.
anything to add, please do.
Sure. Well, I'm going to segue a little bit from here. For the purposes of today's webinar, we're going to unpack a little bit more in Principle 3, which sits at the center of the 5 principles. And as Michelle indicated, this is a kind of a roadmap. It's a framework for how to build great relationships. And as I'm sure we can all imagine, in order to have resilience sit at the center of that, the relationship has to be sustainable. It has to be reliable. It has to be able to withstand some big waves and some rockiness that can come from time to time. And especially in a very, very charged environment that can sometimes happen within a healthcare setting, it can get very stressful. It can get overwhelming. It can get upsetting. There's all kinds of emotions that can bubble to the surface as a result of what you do day to day. And, as we said earlier, we really honor and respect the work that you do in general, and especially for the communities that you serve. And so what we really are focused on doing within your world is creating a foundation that's solid from a relationship point of view, and then being able to carry that with you in all kinds of situations. So we're going to unpack listen up here in a second, and then speak a little bit to what we call surfacing undiscussables. So let me just take a quick opportunity here to give you a little bit of a background, a little deeper experience here. Excuse me there, I just interrupted my flow. There we go.
There are three parts to every conversation: asking, speaking, and listening. And what we like to say is, because you have two ears, you should listen at least twice as much than you ask questions or speak. When we speak, we don't actually learn anything, and listening allows us to start to engage with learning. There is a part of listening that is very important. We call it engaged listening. And what that means is we listen to people for two things. We listen for emotional content, and we also listen for the facts and the summary of the story. So when you're talking with someone, it's
Michelle,
really...
I'm looking for my keys. I don't know where they are. Could you help me with that?
Paul, I'm in the middle of a video talking about
Oh,
listening.
I'm sorry. I'm sorry.
So interrupting, like, not the best thing and a big barrier to listening. So getting back to reflecting feelings and summarizing facts. So when you're with someone and they've got emotional content, again, something's just happened, they're upset about it, reflect back their feelings. It sounds like you feel really disappointed. It sounds like you feel frustrated. It sounds like that made you really happy. And then summarize the facts, the content of the conversation. And then what's really effective, to ask, did I get that? And this creates shared understanding. We both understand the same thing. So in your next conversation, whether that happens when you go home from work and you ask your teen or your significant other how their day was, try reflecting and summarizing without interrupting.
So the reason that we wanted to unpack this one a little bit further is it's so important in resilient relationships. The deepest yearning in our experience of humans is to be heard and understood. And so it's really powerful when we have developed skills that allow us to be able to listen at that deeper level and be able to reflect that in our relationships under all circumstances. So we wanted to take this one a little bit deeper for that reason. By the way, feel free, and we would welcome any comments or thoughts within the chat as we continue through the balance of today's webinar. We want to make sure that your voices are heard and that we give an opportunity to exchange give and take with you. Up on the screen now is another quote. It speaks to the second part of Principle 3, which I'm going to touch on very, very briefly. I just wanted to set the stage for that. It's being able to work through difficult problems. It's not a question of are there going to be any difficulties. It's just a question of where, when, and how intense is it going to be, as I know that all of us are fully aware based on the work that we do. So with that said, let me just take another little bit of a pause here and focus in on another key ingredient within Principle 3, listen up and speak up. This is the speak up part. And again, psychological safety being such an important component of what we're here to talk about today, we want to connect the dots again back into creating that safe space. So one thing I know is surfacing an undiscussable is not for the faint of heart. And it can be done, not necessarily intuitively obvious, it can be done in a way that sustains and builds the relationship and makes it even stronger. And we have several examples of that kind of experience. Just to define terms quickly, what is it? It's the thing we haven't been feeling safe enough to say to each other, at least not yet. And so we want to bring a safe space and environment where we can have difficult conversations, because when we can get through that obstacle that sometimes gets in the way, we can really climb mountains together, and we can talk about just about anything, which is really hugely important in the kind of environment that we find ourselves in, especially in healthcare. So when we get into a deeper conversation about this topic, we walk you through it and we actually engage you in interactive exercises where you're in a position to strengthen these muscles, because without practice, it becomes very, very difficult to do. So I'm going to pause there for a second and again, give you an opportunity to use the chat and give us some feedback, ask some questions. And if we can, Rick and others be monitoring that chat, we'll be happy to engage a little bit further there. And while we're letting that happen, I'm also on stage here for another chat opportunity. And this is also something that would be done in an interactive small group way in terms of building the opportunity to engage around things that are very relevant to you within the health center space. So what is the one step that any of you will take to begin or build on your resiliency journey? We'd love you to be able to come away from this webinar today with something tangible that was important to you that we could take a little bit deeper collectively. So here's that opportunity. What's coming up with my colleagues could help me out. What's coming up in the chat around this one?
Nothing quite yet.
Nothing
Paul?
quite yet. Okay. Well, actually, when we do get into this notion of undiscussables that I just touched on, the room does tend to get a little quiet. So that's not unusual.
So Paul, can you give an example of an undiscussable, just so people know what we're talking about?
Absolutely, absolutely. So imagine yourself sitting in a meeting and somebody with a more extrovert, I'll say, style is taking all the oxygen out of the room, and meaning that they're speaking and speaking and speaking. And you're sitting there saying, boy, I sure wish they would pause and take a breath because I can't seem to get a word in edgewise. And you're just thinking that to yourself. And what we're proposing is with the surfacing of an undiscussable. So that's an example of something that's going on in my head, and I haven't put it out there in the conversation with somebody, in an overt way. And I'm just sitting there getting frustrated. So there's an example.
Mm-hmm.
Michelle, you have another one that you could offer up?
Well, I think for me, it would be, so when you're surfacing an undiscussable, there's a little bit of a decision-making tree. So for that one, I might let it go the first time. But if it happened in every meeting, then I would say something. So it could be really anything. It could be a misunderstanding that you have. Now they're treating you differently, and you don't understand why they're treating you differently. So it's about how do you approach them to raise the issue of, is something going on here? Because I feel like something has changed between us, and I'd like to know what that is. So there is suggested, we have suggested tools for you to be able to do that.
That's wonderful. That's absolutely correct. For instance, just putting myself in a positive intent state of mind can be an important first step in terms of setting intentions before I actually engage around that difficult issue. Another one, as an example, a tool for surfacing an undiscussable includes using open-ended questions that are not answerable with a yes or a no, but they're, so what was going through your mind, in the meeting when you said fill in the blank? So it's not putting blame or finger pointing, it's simply giving space and providing an open-ended question, for example. That's another tool. Any further feedback coming through the chat? Is that we still being quiet there?
One thing that we've actually heard, just as a takeaway, was the idea of collaborating further with staff to discover new ideas, which I think also speaks to what Amanda was talking about creating shared meaning between staff. leadership.
Fantastic. Yes. Well, so let me move towards our conclusion this
Excuse me, Paul.
afternoon.
Wait,
Yes.
just in the spirit of getting everyone in, there's another one. Inclusivity in language and communication or lack thereof is sometimes an issue.
Wonderful idea there. Yeah. Well, so as you think through more of this, we encourage you, to reach out to us and share some of the things that from a resiliency point of view that you may be struggling with. And we're going to give you an opportunity as part of our follow-up here to go a little bit deeper around any aspect of this that's of interest to you. What we would like you to take away in particular is that this is a foundational opportunity to create the how to have a conversation about anything that's important to you as an individual, to the team, and to the organization. Getting back to that graphic that Michelle walked us through, which empowers everybody. This is something that is another important benefit of what we're talking about is the ability to empower yourself to be able to create and build on resiliency within your workplace. So with that said, and I welcome anybody on the team here today to chime in before we finish up. This is up on the screen, again, our invitation to continue the conversation about this topic of resiliency and how smart conversation learning programs creates a foundation for that to be sustainable. And so we're going to give you the recording and the slides from today as a follow-on. We have a tool to offer that will be provided as well. And we're also going to invite you to set up a meeting with Dr. Williams and myself and to explore anything related to resiliency or other issues that you're wrestling with that we would be able to help you think through. Think of it as a sounding board or a thinking partner. And we would be delighted to be able to serve you in that way. Up on the screen as well, we'd love to hear from you, as I just said. And my Calendly link is there to schedule that meeting, and that'll be made available to everybody as well as a follow-on to our webinar today. So I'm going to leave it there and offer up Dr. Williams or Michelle an opportunity to make any closing comments, and then of course Amanda.
Well, I just want to say I know it's difficult in a setting like this to ask personal questions, so please reach out to us if you have unanswered questions, and we'll be very happy to respond.
Michelle?
Yes, thank you again for your time and intention. I did want to mention one thing that when we deliver these courses, it's 80%. This is a little unusual in that it's a presentation, but they're 80% coming from you and 20% of us speaking. If we had a smaller groups, we would have done breakout rooms. So I just want to let you know that because this is about conversations, we have ample opportunity to practice and really work through issues through a dialogue. So it's a bit of a different setting, and we would definitely want to hear more from you because we believe that we can offer you a lot of tools, and you're the reality. You're the people on the ground who also have the answers.
Well, thank you. Amanda?
Yeah, I was just going to say, it's been such a delight hearing from you guys, and I can't say it enough, for those of you joining us from the network and for all the great work that you're doing. But I think I would just encourage you guys to consider connecting with Paul, with Dr. Williams and Michelle to just have a conversation about what they can do to support your organization. I think so many of you have done so much incredible work in this space, but there's something more, and I think having their expertise and being able to work with them to tailor something specifically for the needs of your organization is really what makes Smart Conversations, I think, different and unique. and I think affordable. You know, I think these guys really go out of their way to understand the needs, the budget, and the realities of what it is to be juggling so many priorities, especially at a time where we're facing some unprecedented challenges. But my firm belief and my observation over, doing this since 2005 is that what gets us through these challenging moments environmentally, whether that's, challenges, I'm obviously a policy and advocacy person at heart. So whether that's challenges on Capitol Hill or, it's challenges in public health, it's challenges in health equity, what gets us through that is the culture and the team. And so I'm so proud and grateful of the work that ACU does and the STAR Center that the STAR Center continues to do, and all of the wonderful resources available there. So I think, of course, I'm always going to encourage that. But I think another layer to it, and an opportunity to really have that sort of hands-on technical approach for your organization can happen through smart conversations. And so just really excited to be able to offer that partnership to our network and to our members. And the initial conversation will tell you volumes in terms of whether or not it's the right fit for you guys. And so I think those discovery calls are invaluable. The other thing I'll say is that Paul and Michelle and Dr. Williams have been doing this and some version of this work for so long. And so I think the other thing is just bringing them into our network and developing those relationships, again, in the spirit of discovery, to say, oh gosh, I didn't realize we had a synergy in that space. And, maybe I can connect you with this person or that person. Or so I think the sharing that goes on as well is something that I would call out. But just really nicely done, Paul, Michelle, and Dr. Williams. Thank you so much for all your great work and for the support. And thank you to everybody who joined us today for all of your good work. We're in this together, not to sound corny, but we are 100%. And so ACU is always here to help, and just look forward to continuing the conversation. So enjoy, everybody. I hope it's a beautiful day for the remainder of the day at least. And we're here to help. So we'll talk to you soon.
Thanks
everybody.
so much.
Thank you.
Thank you so much.
Thank you.
Appreciate it.
Thank you, everyone.